Hey everyone, welcome to another NLP Insider live show, and thank you so much for joining us today. We are here live every other week for 15 minutes to talk about everything NLP with industry leaders. My name is David Talby, and I'm the CTO of John Snow Labs. And today I'm very excited to chat with Sam Schifman, Chief Architect at Diameter Health. Sam has been working as a software developer and architect for over 25 years in a number of different industries. In his current role, he's advancing standards for AI and NLP outputs, as well as investigating how Diameter Health and NLP can complement each other. I'm excited to learn more about standards for NLP output in healthcare from Sam. Sam, welcome, and thank you for joining us today.
Thank you. I'm really thrilled to be here. When I joined Diameter Health about 3 years ago, I had no idea what a crazy fun ride it was going to be. AI and NLP have so much potential right now to revolutionize our lives, and particularly in healthcare. And it's been really interesting to get into looking at how that can be a reality and what standards could do for that.
Definitely. So let's jump right in. You have 25 years of experience as a software engineer. Can you tell us a bit more about your journey from software engineer to NLP research?
Sure. Yeah. Well, that would be, a 30-year story at least, but I'll try to condense it down a little bit. I started as a DBA out of college, actually, but right away I started writing code to compare Sybase databases. For anybody out there who's back in the day when Sybase was king. And I, like most programmers, I love solving problems in code. But as I sort of progressed in my career, I realized that it wasn't just solving problems in code. It was making computers actually useful for people. That was really my driving passion. And NLP just kept coming up in that as I was moving through my career. One example is I was working on HR software for doing performance reviews. And this was way, I think, early 2000s. And I noticed that, one of the problems is you have these young managers coming on, they don't really know how to do performance reviews. What if you could use NLP to do sentiment analysis and notice, for example, when a manager had written a positive review for a patient, for a employee who got a negative score, right? So you could help the young managers, gear what they're writing to what they need to. When I got to Diameter Health, it became immediately apparent that, the data that's getting recorded in an EHR and the data that's getting recorded in the clinical notes really complement each other. There's stuff there in the clinical notes that isn't in the structured data captured by the EHR and vice versa, right? So bringing those two together would just be amazing. And, somebody introduced me to Spark NLP for healthcare. It's so easy to set up and so flexible that I've been able to do a lot of really interesting experiments around how I can get into clinical notes, how we can look at meg-sig parsing, how we can even look at the sort of human readable, the pieces in the structured data where maybe there isn't a code, which, believe it or not, there often is in medical data. And then it really became apparent that we needed a standard for all of that if we're really going to unlock the power of that data.
Yeah, so your current research focus is on advancing standards for NLP, and you're also going to give a talk about the progress on this topic at the NLP Summit on October 5th. Why do we need standards for NLP output in healthcare?
Yeah, that's a great question. Healthcare is maybe the second oldest industry in the world. And it has a long history with the written record. In 1960, Dr. Larry Weed was starting to talk about how you really couldn't separate the care of a patient from the record that you were keeping about the patient. And what this meant was that, as computers came in, all the institutions already had a history of recording data, and computers needed to sort of conform to that. They couldn't fight against it. And at that point, each of those institutions was really an island into itself, right? But a lot has changed since then. If you think about it, our society is a lot more mobile than it was, and medicine is getting a lot more specialized. So people are seeing more specialists. And that led to a need for communicating the data between medical institutions, and developed a bunch of standards to do that. And those standards are getting better and better every day. When you look at the potential that NLP has, it's at a similar sort of starting point where we're really going to be able to grab a lot of great data out of those clinical notes and MedSigs and other places, right? But we have to be able to represent that data in a way that it can be easily communicated. And we have to do that responsibly, which I'll talk a little bit more about at my talk. But what I think about is, there was a presentation I saw a couple of years ago, and I apologize, I can't remember where the source was, but it was somebody who was working on visualizations for healthcare. So they were helping patients tell doctors their stories through visualizations. And you could definitely see how you could do that off of structured data. But if you could enrich that data with all the NLP data out there, then you could really increase the volume and quality of that representation. Now, that's not something that an NLP person would ever think about doing necessarily, right? But if it's in a standard form, then anybody can leverage that data for any use down the road.
So what would those standards look like?
Yeah, that's a good question. I mean, I think the first thing that I think about is we really need to be responsible with the data. There's this whole thing where, basically everything is probabilistic in nature, right? I mean, if we want to get down to the science of it all, but you don't even have to get to quantum mechanics in order to see that there's a lot of probability involved. In the North American Journal of Medical Science published a article talking about how more than 6% of lab results have clerical errors in them that are significant, right? Mm-hmm. There's always a non-zero chance that the doctor recorded it wrong, or it got transcribed wrong, or that you have a disease which nobody's ever heard of, even though, like the symptoms look like something else. So there is a bunch of probability in medicine. On the other hand, we train our doctors to be deterministic because we need them to be, right? For our own psyche, it would be really hard if our doctors were always telling us wishy-washy things, right? So that creates this conflict, right? And I think when we start thinking about standards, one of the things we can look at is how do we make sure that we're representing the probabilistic nature of the data within the standards. That's one thing, and I think once you do that, you can be part of a differential diagnosis, right? Because you're not replacing the doctor, you're not coming to a conclusion, you're giving more evidence that they can use. The other thing that I noticed as I was working with NLP is that the output of NLP tends to be very, very standard. I mean, already there's, the way that people get to it, the internals, the magic of it is really there in those internals. And what they produce, for example, if we talk about NER, what we're producing is, entities, some metadata about where we found that entity, and some confidence about that, right? Sometimes we also can have relationships between entities and things like that. But all of that data is ripe for standardization. And I'm going to talk more specifically about what that standard will look like in October. But one thing I do think is very important is to think about the entity types that we get. One of the frustrations I had when I started working with multiple different models was each model had a different way of naming the entities that it produced or identified. And I have some ideas about how we could standardize that too. And I'll talk about that in October as well.
Yep. And I think, by the way, I agree with you. Different models sometimes use the same name to refer to different things, and sometimes different names refer to the same thing. So I think one example, yes, you have symptoms and problems and diagnoses and observations and such, right?
Yes.
And the problem is you can say, oh, these are basically the same thing, but you also get into cases where they are not, right?
Yes.
And so I think when we do this, sometimes you can say, hey, why don't you call these two things the same? And sometimes people say, oh, no. When I mean diagnosis, I mean a coded diagnosis. I don't mean, right, a suspected or symptomatic one.
Yeah. In the standards community, like in the structured data standards community, they've actually solved that problem by saying, the lexicon is going to be this, and then we have code systems to get to the granularity that you want to get to.
Yeah.
And so I think looking to that side of the house, we might be able to find some things that might help us there.
Mm-hmm. Yeah, definitely. Yep. And also, I definitely agree with you on the probabilistic nature. Which I think also something that's missing sometimes from structured data as well.
Yes,
yes, right. Yeah, because the fact that something is written on a medical record. Say maybe I didn't tell the doctor everything. Maybe she didn't write down everything. Maybe there was a clerical error. Maybe it was a misdiagnosis. Maybe there was a identity theft, and it's not even me. Yeah, you're talking.
Yep.
Yes.
Yep.
Probabilities are low. Yes.
It's unfortunate that people's psyches don't deal with that real well.
Of course, because look, when I go to the doctor and I have a problem, I'm in pain and I'm concerned and maybe slightly afraid. I don't want someone to tell me, well, there are multiple options we don't really know. That's not what I came to hear, right? I came to hear, take this and this will fix it. Yes. Yes, definitely. So where do you think NLP and AI will have the greatest impact on healthcare?
Yeah, I think there are two big forces that are coming down on healthcare. One is that the U.S. Census Bureau tells us that in 2034, there will be more people over 65 than under 18 in the U.S. for the first time ever. That's already true in Japan, and predictions will be true in many places in Europe. At the same time, we're losing medical professionals by the droves, right? Yeah. I mean, you hear about it every day. Sometimes because of COVID, sometimes because of that retirement, more people hitting 65, and sometimes because of burnout.
Yep. And we're not training them fast enough. Yes, definitely not.
It takes 10 years to train a new doctor to replace an old doctor, right? So that's, so those two things are going to come together. We're going to have an increased demand because older people need more medical care, and we're going to have a decrease in supply. And whenever that happens, there's an opportunity, but there's also some pain, and that pain falls on not just patients and doctors. That pain is really going to fall on their loved ones and on insurance companies. And I'll talk a little bit about both of those, right? So loved ones, like as people get older, we naturally fall back on our children or our nephews or some loved one in the family to help with our care, right? And that person is generally not a doctor or medical professional. They also generally live far away nowadays, right? My parents are in Texas, for example, and I live in Massachusetts. And so in order for me to help my parents, I'm really going to need good access to data, and I'm going to need the tools that NLP and AI will give me to know when I should actually act on that data, right? I need assistance to know when I need to insist that my parents get in to see a doctor, and when it's something that, I can let lie and they'll see their doctor in the normal course of events, right? Mm-hmm. I think a similar thing will happen with insurance companies. Their costs are going to explode with this increased age in population, right? And their only tactic is going to be to make sure that their members get the preventative care that they need, right? Health plans already know that there's a huge return on investment if you get people the right preventative care, but they're not going to be able to hire enough nurses due to that shortage of medical professionals to manage all of that, right? So they're going to need administrative staff to do that, and those administrative staff are really going to need AI and NLP to help them know, which member is the member that really needs care now. Mm-hmm. And so I think that's one aspect. And then another really key aspect is we're going to have to get really efficient with the time that we do spend with doctors, right? Another thing about aging population is that their medical record tends to be larger, right? You just have, more, a 10-year-old only has 10 years of data in their medical record. A 65-year-old has 65 years of data in their medical record. And they tend to get seen by more specialists. And that's going to, that is going to cause this problem of their medical records being huge, the doctors having to read through a lot of information to get to the pertinent facts. We all know that generally won't happen because the doctors won't have time. So they're going to be asking questions over and over again of people who are already kind of, not necessarily completely there, and they may be getting wrong answers. And so if we can surface the right data, which, Diameter Health is all about surfacing the longitudinal record out of the structured data. But I think we could bring in data from the NLP, from those clinical notes, surface that all up in a way that could really make a difference in that doctor-patient interaction, where the doctor can really see what they need to see very quickly and avoid repeated questions, but also get to the right data that they need. Mm-hmm. So I think those are the two areas where I think that AI and NLP are really going to play a huge role in the next 10, 20 years. And I'm just super excited to be part of it.
So the two areas are prioritizing which patients need the most help and then making the most efficient use of time when you are with a doctor.
Yeah.
Mm-hmm. I think that makes sense. And a lot of work remaining for us to get there.
Yes.
Yeah. So as part of this work, you are using Johnson Labs Spark NLP for healthcare. Can results from Spark NLP be represented in the standards?
Yeah, I mean, I already mentioned that I really do love Spark NLP for healthcare. It's super flexible. It was really fast to set up and easy to run all these experiments. And in order to run these experiments, I did do an exercise of mapping Spark NLP data to the standard that I'm proposing. And, it works quite well, actually. I've been able to do a number of experiments around extracting data from clinical notes. I've been able to do some experiments around med-sigs, and I've been able to do some experiments around that, the structured data where there were no codes, all using that mapping, and it's been really efficient. And I'll give some more examples. In October, I'll actually show you guys some actual mapping going on. But really, a standard doesn't exist without the community adopting it, right? Standards, you can write standards all day long, but if people don't get in there and use them, they aren't really standards. And the thing that I've learned about standards is that they really come out by community involvement. I'm sure there are things that I haven't quite gotten right in my proposal. And if we can, as a community, take a look at it and make it better, then that's great. So I'm really hoping that people will get involved. I'm hoping people will come to the talk on October, but I'm also really open for people to reach out. My email address is sschifman with one F at diameterhealth.com. But you can also go to our blog at diameterhealth.com. And if you look for why we need a standard for AI output, which was written by John Demore, one of our co-founders, there's a link there within that blog to our white paper, which I actually think the link to the white paper was going to get put into the chat here. So hopefully you guys all have access to it.
Yep, we'll share the link here right after the talk.
Yep. But we'd love to keep the conversation going. Love to get feedback from anybody out there who's interested.
Agreed. And I agree with you. I think this does need to happen because extracting information through NLP from unstructured medical notes is becoming a much more commonplace and standard thing to do. And people will definitely be looking to see how you extend FHIR, right, to include those fields, including confidence values, right, where it came from, the explainability aspects which you address.
Yeah. And there's some good questions about when you want to surface that data, when you don't want to surface that data, and how you can do the mapping in ways that really make sense. I do think there's some other great examples of this where in computer vision, standards came in and helped a lot. Global positioning standards helped a lot. We wouldn't have Uber without that, or Lyft.
Yep.
And there are many other examples of where standards have saved the day. So.
Yep. So Sam, thank you very much for joining us and sharing your wisdom. Everyone, we will share the link to the blog, and please do reach out to Sam if you'd like to get involved, provide feedback, start that on the standard, try it. And if you'd like to learn more, please join us at the NLP Summit. Sam's session on how standards for NLP output can revolutionize healthcare will happen on October 5th. The NLP Summit itself, it's the largest applied NLP community gathering for applied NLP professionals. We're going to have over 3 days more than 50 different talks from different industry experts and technologists. And then in the following week, live workshops and certifications. Registration is free and the conference is online, so you can really just join from anywhere. With that, thank you very much for joining us today, and see you at the summit. Thank you.
Thank you for having